My name is Sam Radinsky, and I'm a second year in the Master's in Mental Health Counseling program. I am currently interning at Smart Therapy. It has been really fun. I've been doing a lot of individual therapy as well as some groups. I started 2 groups last semester, one for LGBT individuals and another one that's for individuals who are caregivers in their lives. So both those groups ran for about 6 weeks, which was really awesome to get to see growth of participants as well as growth of the group in general. I would say I approach therapy as interdisciplinary because clients come in with problems that don't really neatly fit into one framework all the time. So I think that at my internship, I regularly use a bunch of theories. Some that I pull from frequently are psychodynamic, feminist, as well as CBT. So I think that those are ones that I'll usually pull from, but it really depends on what the client needs. Everything is really so individualized. I think that the benefit of this is helping clients feel understood and supported. They're able to maybe explore a bit deeper within themselves, but also contextually within the world, and just gain a deeper understanding of some of the emotions and some of the patterns that are maybe coming up, while also gaining some concrete skills on how to improve daily functioning or how to function in a way that is more effective for them or in a way that they want to. So I think that balance of insight, but also that balance of action has helped to strengthen engagement and also help with symptom reduction in clients, and also building strong therapeutic alliances when you show up and you are aware of some of these greater things that could be impacting clients. They're more likely to engage or trust you as a clinician if you're being upfront about some of these things that you're aware of. The first client that comes to mind for me is a client that I worked with who was experiencing a lot of panic disorder, so panic attacks, and a lot of anxiety related to public transportation. And with living in the city, it's quite nearly impossible to avoid some of these things. The first thing that it came to my mind was, delving into CBT, wanting to help the client navigate this and also address some of these avoidance behaviors that were coming up. However, as we were kind of navigating CBT, it became really clear that the panic that this client was facing was connected to earlier trauma that was causing some of the deep fears of, feeling trapped or unable to escape or being stuck on some of these forms of public transportation. And I think that was what really allowed me to realize, this isn't just a CBT issue, it needs some psychodynamic work as well, and that became crucial. So I think integrating these approaches really allowed the client to not only gain a tolerance in riding public transportation again, but also maybe understand why these spaces felt threatening or scary. And that insight, I think, allowed him to kind of reduce some of the shame that he was feeling around some of the feelings that were coming up and increase the compassion that he had for himself. So I think the outcome was not just reducing some of these symptoms, but also allowing and fostering a greater sense of emotional understanding as well as personal agency in life. I have always been super into sports and a student athlete my whole life. So I love the gym and anything outdoorsy and also athletic. So just taking a hike or going on a walk, especially in the city, there's just so many fun spots to check out. I also love rock climbing. So I've been doing a lot of that, and there's a lot of fun gyms in the city as well to check out. So I think just having this space is super cool to allow yourself to practice some self-care outside as well.